I'm showing here a pogo jump progression. This is a progression I would work through over potentially several months, not done as one drill, but I often show my athletes and patients the progression, so I want to outline that in this video. So there's going to be 4 components to it, starting double leg and then going to single leg. So we're going to start double leg, and then I'm going to go double leg side to side, and then I would progress to single leg, and then single leg side to side. All right, so a couple nuances. First, now that you know the movements, I like to do it at least at first to a metronome. And so the metronome, I'm going to start about 150 beats a minute, and I have it on my laptop here. And so you can just Google metronome, or there's some free apps, and I'm going to try and time it to the beat. And so a faster metronome means I don't jump as high. A slower metronome, if I bump this down to 110, I have to go a lot higher and generate a lot more force. And so some progressions that we use are starting double leg, side to side, single leg, side to side, but then I can also play with the metronome, and I can start to bump that cadence down to get a little bit more force. And so we might play with one or more of these variables, but on a simple level, I like to start with folks practicing these, once or twice a week to start, maybe going up to 3 times at the most, usually with just 2 sets, maybe 3 of 20 to 30 seconds with some rest in between. And I want to start light and easy to get used to this stimulus. The main technique is a nice tall posture, a little squeeze of the glutes, and then I don't want to get heavy in the knees. So I want most of this to come from the foot and ankle. And so if you're doing these on your own, you might set up a camera and look to the side, and look at how my knees aren't bending a whole lot. This is mainly coming from the foot and ankle. And that's what mimics some of the forces we want to get in running. And so if you set up a camera on yourself from the side, we don't want to see a bunch of that in the knees. Not that that's dangerous per se, but it's less efficient. And sometimes it can place a lot of load, which may be uncomfortable if you have a history of anterior knee pain. So that's double leg. Side to side, nothing really changes other than I'm going to go about 4 to 6 inches to one side and back. And so here I'm getting fluid with some side to side stability. You'll notice my head's roughly staying in the same spot. And so this is really coming from the lower body. If you have a line on the floor, you can start with that middle of your feet. And I'm really just going right foot kind of over left foot. So it's not a big motion. I would start at the same cadence. Then we go to one leg and start here. Might start with just 20 seconds on one leg. And then I got a line here, and I'm just going to come over side to side. And so, progressions are usually spend about 2 weeks per progression, maybe longer depending on if you're rehabbing something. Of course, check with your provider, assuming you have pain. You want to be maybe working through somebody on this, especially as we go into some plyometric loads. But let's just say 2 weeks per progression. As it starts to get easy, you might then either change direction, so add side to side, increase the cadence, or go down to one leg, but I would not do all of those things at once. So I want to have one progression at a time where we're making it a little bit harder. For my patients who've had an ankle injury, I like to set this as a discharge goal that we get at least 10 seconds, potentially up to 30, side to side, feeling the same to you as the other side. And so I've had some injuries on my left ankle. Might be hard to see on video, but I don't feel like I'm quite as bouncy. I have no pain, but I just know that my left is still different, even though it's been 1.5 years to almost 2 years, than my right. What does that tell me? I need to keep working on it. And so these are something that I work in or try to at least once a week, often twice, because my ability to absorb force, rebound and be agile is not the same side to side. And so I find it be helpful to have some discharge goals like this. A lot of times folks don't need to see me anymore because their ankle doesn't hurt, but we know it's different. How do we know when we're done rehabbing something? When it's as strong, if not stronger than it was before, and equal or better to the other side. So I know I'm not done rehabbing my ankle because I have a difference in my ability to do some of these hops side to side. And so that's where progression like this can be helpful. We can start here, or even if that bugs you, we can just start with some calf raise pulses, getting some speed, and then I can progress back in. One variation, if you feel like you want to get a little more control through the hips, I might take a band and place that about mid-shin, get a little tension on it. My feet are maybe a touch wider, and I'm going to come here. I can kind of go same side to side. On one leg, I can put it just above, single leg, side to side. I'm just keeping tension on the band. All that does is help control where the knees are. And so sometimes I'll add that. Sometimes it can also help control the foot position if our feet are collapsing inward. So it doesn't need to be a big stimulus, but that's one variation that can potentially be helpful. So anyway, that's a pogo jump progression that can be helpful to work through and to be continuing to work on after a foot and ankle injury, especially if you notice differences in your capacity to do that side to side.